Well, good afternoon, everybody, and thank you for joining us. This is the third in our series of webinars planned to keep you up to date and help you understand the COVID-19 vaccine as it relates to your business and your employees. This series is in partnership with the Employers Association and the V Project and the Toledo Regional Chamber of Commerce. I am Julie Sanderson, and I am the event director with the Chamber. We do have one more webinar scheduled next week, March 31st at 2 p.m. By now, especially for those who have joined us for a few of these, you may know about the V Project, a community initiative to educate, motivate, and vaccinate the entire Northwest Ohio corridor to dramatically slow the spread of the COVID-19 virus. Medical experts agree that we need 70% vaccination rate to get to that herd immunity that allows us to be safe and thrive again in our businesses and organizations without restrictions. Something important to all of us. We know to accomplish this, leaders from industry, government, nonprofit, healthcare, education, and religious organizations have united in this unprecedented effort to effectively mobilize our community to achieve that 70% vaccination rate. There are more than 250 community leaders involved in the V Project and more joining every day. The Business and Industry Committee is just one of the many facets of the V Project, and the Chamber and Employers Association are both part of this committee. And together we have assembled a panel of experts to provide an overview to help businesses understand the benefits that the COVID vaccine offers and how to navigate the challenges and complexities associated with that vaccination process as it relates to your business and employees. I'll now introduce Terry Vanier, Seminar Learning Manager at the Employers Association, to introduce today's panel of experts.
Well, thank you, Julie, and good afternoon, everyone. Today we are pleased to have back with us for this week's panel, Brandon Polinsky with the Toledo-Lucas County Health Department. Brandon has a master's of public health, veterinary public health from the Ohio State University, and has been working in the public health field since September 2013. As the Toledo-Lucas County Health Department's Quality Assurance and Accreditation Coordinator, Brandon's helping the agency achieve public health accreditation while working to develop and instill the principles of strategic planning, continuous quality improvement, and performance management. Brandon's a graduate of the 22nd cohort of the Mid-America Regional Public Health Learning Institute, a year-long fellowship sponsored by the University of Illinois, Chicago, designed to strengthen and promote each fellow's core leadership competencies and skill sets. In addition, he's been trained by the Center for Public Health Practice at The Ohio State University as a performance management peer coach to provide technical assistance to Ohio's local health departments on performance management. Brandon's also a member of the Toledo-Lucas County Health Department's disaster response team, a multidisciplinary team trained to aid in the response of public health emergencies and to serve as safety officials for the health department. Also with us today is Mechelle Zarou, partner with the law firm Shumaker, Kendrick. Mechelle focuses her practice in the areas of labor and employment, immigration, and sports and entertainment. She's known for immersing herself in her clients' businesses and industries. Dedicated to providing excellent service to clients, Mechelle recognizes the importance of having a real understanding of her client's business, allowing her to give practical and actionable legal advice. Mechelle has extensive experience representing companies in all areas of labor and employment law, including wrongful discharge, discrimination, workers' compensation, unemployment compensation, business immigration, labor negotiations and arbitrations, and unfair labor practice charges. Mechelle's not only involved with her clients, but she is also heavily involved in the Toledo community. Mechelle uses her experienced voice to welcome and advocate for immigrants who enhance Toledo's economy and help create a vibrant Toledo. She's also an avid supporter of the arts as she sits on multiple boards to keep Toledo artistic. Mechelle earned her BA with honors from the University of Michigan, her master's degree in English from Duke University, and her JD from the Duke University School of Law. We also have with us Alicia DeCant, Director of People Operations and Total Rewards for Libbey. Alicia is focused on optimizing HR services and enabling processes that meet the interests and needs of an agile, inclusive, and diverse workforce. She's accountable for strategy, design, development, and implementation of Libbey's Total Rewards and has over 14 years of comprehensive HR leadership experience, primarily in the manufacturing and healthcare industries. Alicia earned her undergraduate degree from Ohio Northern University and her MBA from the University of Toledo, and holds the professional certifications SHRM-CP and PHR. She's a member of the Employers Association's Board of Directors, is involved in the community as a court-appointed special advocate volunteer for Lucas County, and is incredibly passionate about people and culture. We are honored to have each of you with us this afternoon, and we truly thank you for taking time to share your expertise with us. At this time, Julie, I'll turn it back to you.
Thanks, Terry. And before I turn it over to our panel, just a reminder to keep your microphone on mute to reduce background noise. And also for questions, you can either put those in the chat or make a note of those along the side. One of the things that we have found out through these is a lot of times the questions get answered as we move on through the presentation. So we will take care of questions at the end, and Bob Bethel, Vice President of HR and Learning Services at the EA, is going to walk us through the Q&A portion of this. Also, we are recording this session and it will be available for you to review usually in about 24 hours. We'll go ahead and send that link to the email that you provided in your registration. And we also know that our speakers can attest to this as they go along, that this is an ever evolving conversation. So note that what is being shared today is date and time stamped as of March 24th. But we do encourage you to go back and look at the presentation and share as you feel necessary. So with that, I am going to unshare my screen and turn it over. We'll start with Brandon.
Okay, and I have to say, Terry, I had forgotten all about that bio being out there. Like you did your research, you found that. I'm not sure exactly what state you found that out, but that was interesting to hear again. But okay.
That actually came from Julie, so that was all her magic.
Okay, so I am going to start. I just have a short update as I've been doing. If I could just get confirmation that you can see the slides. Perfect. All right, so I did trim these down a little bit from some of the other sessions. Right now in Lucas County, this is as of today, we are almost at 37,000 cases. The majority of those are confirmed through the PCR genetic diagnostic test, and almost 6,000 are from the rapid antigen test. We are close to 800 deaths. We're at 791 total. And as far as testing is concerned, we've conducted at least 160,700. That number is going to be lower than the true value because testing sites are not required to report the number of tests they do to us, only the positive tests. So these are the partners that do report to us our total since the start of the pandemic last year. So quite a few that we've done. If you find that you or someone you know may need a test, you can look at the sites in Lucas County. We have most of the testing sites there, those that wanted to be listed with us. So you can just go to healthylucascounty.com COVID test and get scheduled through there, or at least find the information to get scheduled. All right, I want to move into kind of where we're at right now. You saw the total number. Right now, the blue line is the 2-week average, the most recent. So we're sitting at about 50 cases a day, just under that. It's been pretty consistent for the last 30 days with that. I expect those two to flip-flop again as far as the most recent average to be lower than the other, but you can see that it's not necessarily consistent values day to day. So we are still getting some higher values, the 71 and the 60s, and those are by test result date as they're reported to us. So we're somewhat consistent. We're happy we're on the lower range. We're hoping to go lower still. But we've been kind of at this 45 to 50 range for a good while now. We can't seem to break much lower than that just yet. So hopefully in the future, we keep trending down, but that's where we sit at the moment. Just wanted to show you the per capita map comparing the zip codes in Lucas County. This is per 5,000 residents. So we're still seeing 6 to 9 cases in the majority of the county per 5,000 individuals in those locales. But this map looked a lot worse a couple months ago. It was almost all red. So we are definitely doing well in terms of keeping the case burden manageable and low. All right, so I want to jump into the variants. As some of you may have seen, Lucas County had its first confirmation of variants just yesterday, in fact. These are the 3 main variants that the global community is really watching right now. In the US, we have all 3 of them. 7,500 cases of the UK variant, 219 of the South African, and 61 of the Brazilian. Only one of those in Ohio. We do have 158 of the UK variant in Ohio, and we have several of those now in Lucas County. The Ohio Department of Health informed us just the other day of the identification of those. And they do a passive surveillance program of samples. They don't genetically sequence type every single sample that is tested, but it was through that passive sampling that from our jurisdiction that they found those UK variants. So it is here. That variant does carry with it increased transmissibility and the potential for increased disease. One of the good things, and I'll state it again later, is that all 3 vaccines available to us here have shown cross protection to these variants. So vaccination is still a great way to kind of mitigate illness that you might receive. Now, there are individuals who get the vaccine and do develop COVID, usually one of these other variants, but the disease course tends to be less severe. There's almost no hospitalizations required. And to date, as far as I know, there have been no deaths of someone who has been vaccinated and subsequently developed COVID. So there's good news there, but the variants are here. So we want to make sure that we're still keeping that vigilance. We're wearing our face coverings out in public, social distancing when possible, as much as possible. And if you're sick, please stay home or consult your doctor. Encourage your staff to do the same. And the other big thing is, I know how much no one wants to have to sit here. We're going to stay home, or you got to stay home for quarantine. But that really is one of the biggest ways to prevent the spread in our community. We do at the health department, we recommend the 14-day quarantine, as does the CDC, but we recognize that that's not always feasible. And we do offer the 10-day quarantine as well, with 4 days of just monitoring your symptoms afterwards. So if you are called by one of our tracers, we appreciate your interview and wish you the best. But hopefully those are not too. I'm getting in the weeds in my own sentence structure. Hopefully everyone can follow along with those rules and guidances. Okay, so vaccine progress in Lucas County. As of yesterday, we have given 105,198 first dose vaccinations. And I put a plus sign by that because this is as reported by the state, the information that's been submitted to them. But we have also vaccinated other communities. I mean, we have individuals from Michigan, we have individuals from the surrounding counties. So I would estimate that the total number we've actually vaccinated is higher, but in terms of Lucas County, we vaccinated almost a quarter of our population locally, which is fantastic. Too far. Similarly, about half of those, 67,000, have already received their second dose and are on to that full immunity, the 2 weeks post the second Moderna and Pfizer shot. You're considered fully immune after 2 weeks from the 1 dose Johnson & Johnson, but the other 2 do have that 2-dose series. So again, 15%, almost 16 of our local population is fully vaccinated, with almost a quarter at least somewhat vaccinated, somewhat protected. We're coming up on a new and probably the last phase of vaccination starting next week. And that information is wrong under 2D now that I'm looking at it right now on the slide. It should say Ohioans aged 16 and older. I think I typed it, deleted it, and then hit edit undo. So that information under 2D is incorrect. It should be Ohioans 16 and older, regardless of any medical conditions. One thing to note with that is that individuals who are 16 and 17 can only get the Pfizer vaccine at this time. Anyone 18 and above can get Moderna, Pfizer, or Johnson & Johnson, but those younger individuals do require to be focused in that Pfizer vaccine. One other thing, some individuals have a preference of which shot they want to get. They've researched it. They've said, well, I want Johnson & Johnson or I want Pfizer. Really, the best thing we can say is that the best vaccine is the ones available to you. So if you have a chance to get signed up, we definitely encourage it. If you want to wait for a particular vaccine, that's your prerogative. But we're really hoping that just as many individuals get vaccinated as soon as they're able to, which as of next week is pretty much anyone in Ohio 16 and up is now eligible. Understanding the difference, I covered this briefly before. Time to full vaccination for Johnson & Johnson is 14 days. Pfizer and Moderna, the 35 and 42 are based on 14 days after the second shot. There's 21 days between the first and second for Pfizer and 28 days in between the first and second for Moderna. So that's the total time from the very first shot to your full immunity. Where it says preventing symptomatic COVID in the US, I know it looks like that J&J is lower, but really that's just, it's a different type of vaccine. The way it's produced, it's not an RNA vaccine. It's an adenovirus. It uses a different delivery mechanism. But really they're all effective. They're all great at preventing illness. And you can see that last line, preventing hospitalization or death. They've all performed very well in that regard. We are going to be seeing a change in the way appointments are scheduled starting later this week and then moving forward. We, as well as the hospital partners and really the entire state, is moving to the state-based system called VMS, the Vaccine Management System. Right now on our website, if you go to schedule appointment, it'll still take you to our acuity system, the one we've used since we started scheduling for vaccinations. That will change. The link will still be there that says schedule appointment, but it's going to change to this get the shot at coronavirus.ohio.gov link. And that is going to be the way through which you schedule. One caveat, the VMS system is being continually updated. Even now, the state has taken feedback from health departments on what they want. Initially, we couldn't do closed pods for various groups. They added that functionality in. One thing that we don't know what they're going to do, and I wanted to throw this caveat out there now, is right now, if you were to go there today, it would say, I certify that I'm 40 and above, because that's the current eligibility this week. New appointments will go live early in the morning on Friday, and that may still be there, even though 16 and up can schedule for next week's appointments that will go live on Friday. You may just have to say, yes, I certify I'm 40, and then put your actual birth date in if you are registering someone under the age of 40. So we just wanted to give that caveat that you may have to do that. We don't know if VMS will be updated in time to allow 16-year-olds to say, yes, I'm 16, I certify I'm at least that. So that's just one workaround, but we are switching systems this week. We expect a fairly seamless transition, but with technology, you know, it really can go either way. We have worked with it, we're working with the state. So that is a change to expect there. Otherwise, other than that, I have reached the end of my quick set of slides. So if there are any questions, I haven't seen the chat throughout this time. Okay.
Thanks, Brandon. Now, Mechelle and Alicia, we're going to turn it over to you, and we're excited about the format that they have chosen to do this on. We've got a little conversation that's going to take place here between two of our experts.
Yes, that's right, Julie. So what I have done is I've compiled a list of questions, questions not necessarily that I'm only hearing here at Libbey at work with employees and leaders, but just questions across the community that are coming across my desk, and even some questions that have come to Mechelle as well. And so I just have a few questions for Mechelle, and would love to hear some of her responses.
Yeah, and we also invite Brandon to jump in where you think you can add some value. Feel free to join us and add your 2 cents, because there's at least a few of them that it would be nice to hear your perspective on.
Yes, absolutely.
If you're willing.
So the first question I have is, I think, probably the most commonly asked question that I've seen and heard so far, and that is my employer, is Libbey, for example, required to have a COVID vaccine? Are they required to make employees have a COVID vaccine?
Right, like making it mandatory.
Yes.
Yeah. I mean, that's the hot button question, right? I think as a legal matter, they could mandate the vaccine. It's kind of arguable. There's some caveats to that, but I think the real answer is they probably don't want to at this point. I think there's a lot of downsides to mandating the vaccine, and the exceptions tend to swallow the rules. So it's probably not a good idea to mandate it, although legally I think they could. Let me just clarify, what the heck does that mean? Well, right now the vaccines are all authorized under an emergency use authorization. They're not fully authorized by the FDA. And so right from the get-go, I've been telling clients, look, I don't think it's a good idea to mandate something that's not fully authorized. That line of thinking has actually been picked up by a plaintiff's attorney in New Mexico, where we've seen our first lawsuit against mandatory vaccines filed in New Mexico. And the basis for that lawsuit is that under the federal emergency use authorization law, there's language suggesting, which is arguable, but suggesting that employers cannot mandate it. I would say the language is very unclear, and it mentions that employers have to tell employees the consequences of their refusal to take the vaccine, which implies you can actually make it mandatory. But I think that's something for the courts to sort out, and it kind of lends support to my theory that it's probably premature to mandate the vaccine at this stage. And the other considerations aside from the legal, just can you or can't you, are more practical, which is you have to make exceptions for people who have disabilities and can't take the vaccine, or who may have a religious objection. And you could be spending a great deal of time addressing these exemptions and taking away from getting the business of your company done. So the exceptions swallow the rule, and administratively that becomes a problem. And then what happens? Are you prepared if half your workforce says, no, I won't take it? And we're seeing that in nursing home staff. I have a nursing home client that said literally half their workforce didn't want the vaccine. Are you prepared to fire half your workforce? Because that, if you're going to mandate it, that's what that means. And you could find yourself without employees. So I think that risk is too high for most operations. They can't just have half their staff gone. So it makes sense to make it voluntary. And I think it makes sense to do what the V Project is really trying to do, which is really educate and encourage. And I think that's what the tack that Libbey's taking, right?
It is. It's absolutely what Libbey's doing. We're focusing more on education and encouragement. At this point, it's not expected, and nor in the near future do we expect that all of our employees and associates will need to be vaccinated. Right now, we are encouraging everyone, and we're just hopeful that our associates will make the most informed decisions for them and for their families based on the public health guidance.
Yeah, I think that makes the most sense, and that's kind of what I'm working with employers on when they do ask that question.
So kind of piggybacking on that, Mechelle, if we say, okay, it is required and we have the employees who don't want it, then what? And are there exceptions?
There are, and like I said, you have to still accommodate known disabilities of workers. So if an employee comes to you and says, I have a medical condition that makes me susceptible, or I've had allergic reactions to vaccines in the past, I can't do it. You have to follow your normal ADA disability accommodation process. And as you know, that's a very time-consuming process. It's not something that's just a decision you instantly make. Similarly, if people have religious objections, you have to accommodate sincerely held religious beliefs. And you really don't have the luxury of questioning whether their belief is sincerely held. The law really requires you to presume if they're presenting it to you as a sincerely held religious belief, you need to accept that unless you have a basis not to. And so the only way you avoid accommodating such a religious belief is if you can show it would be an undue burden. Very few employers are going to be able to meet the test of undue burden, because what is the burden? We're still social distancing, we're still wearing masks and doing all the things that we need to do to prevent the spread of COVID. So really, how much of an impact of one person not getting the vaccine does it cause on the business? Maybe a healthcare facility would have an undue burden argument, depending on the person's role in the facility. But I think they may not, and I think we've covered this with the flu vaccine for many years, especially for healthcare employers. So it's very difficult. Can you just have an exception for someone who just is morally opposed to vaccines, as many people are? Many people have a lot of different reasons. Well, that's not legally required, but you're going to have a lot of discontented employees if you don't address those people who have such a strong moral objection. Again, these are problems that create administrative hassles that are ongoing, and they're not going to stop, because this is going to continue through a long process.
Right. So if we go the voluntary route, what about incentives? Like, is there anything that we can do to drive that encouragement and incentivize our associates to get the vaccine?
Look, my idea of an incentive is more of, it really needs to be something it has to be a voluntary process, and that means we can't incentivize it so much that it's no longer voluntary, right? And under all of the wellness plans, I know a lot of HR people have been really following this, the wellness plan guidelines, which have been instituted and then removed, and who knows where they stand at this point. But the HIPAA rules do have some teeth to them. ADA wellness guidance has been retracted, but will probably come back in some form. But ultimately, the gist of it is your incentive needs to be de minimis. So we're talking a water bottle, a small gift card. It can't be such a high amount that people feel like they're being coerced into doing this. The other thing is, you still have to make accommodations for those people who aren't able to get the incentive. So you have to make some way for them to get that incentive if they have a disability, if they have a religious objection. So again, you're not getting rid of those administrative hassles. You still have to address those claims and figure out the alternative incentive. So again, it makes it difficult. I think the better option is to have educational sessions, offer pizza, offer ice cream, something like that. Where you're incentivizing the attendance and you're educating, but you're not doing something that runs afoul of the wellness program guidelines or HIPAA, and you're not to the point where you're actually coercing employees. Those of us who deal with workers' comp all the time, we're familiar with this. There's exemptions for recreational programs if they're voluntary, but if the pressure is so high to do the recreational activity, then the law says it's no longer voluntary. And I think that same standard applies here. And you need to be very careful that something that you're presenting as voluntary truly is voluntary.
Yeah, that's exactly. Go ahead.
I was just going to add an informational incentive is that those who are vaccinated, if you come into contact with someone who is positive, you do not have to quarantine unless you develop symptoms yourself. So anyone who is fully vaccinated past those 2 weeks beyond the last shot, whether it's the 1 or 2 dose series, you do not need to quarantine unless you develop symptoms. And also, for those who say, well, I'll just get COVID then and I'll get my natural immunity, that is only good based on the current CDC guidance for 90 days. So if you were to get COVID again or get exposed again after those 90 days, you would have to quarantine again, isolate again, whereas that does not hold true for the vaccine. There is no time limit right now on the vaccine as far as when you may need to quarantine again for the immunity that it gives you.
That's great information. And I think that kind of thing, that's going to be more helpful to encouraging people to vaccinate than an ice cream cone in most cases, or a water bottle.
Absolutely.
Yeah.
And that's kind of the route that Libbey's going right now. We are going to go the voluntary route. We're assessing the opportunity to actually have a vaccination clinic on site. And so that was another question, Mechelle, is what are your thoughts on that, on employers or businesses facilitating a clinic at their establishment and encouraging in a voluntary way, of course, associates to come get vaccinated?
I would like Brandon to jump in at the end of this answer to just talk about the logistics of actually doing it, but just the legal issues that are raised by doing it. What you have to think about is not just the fact that you're going to make it available on site. There's a couple of practical considerations. One, if you're having everybody vaccinated on the same day and they all have side effects the next day, are you going to have a mass group of people who don't show up for work the next day? And can you do that? Or can you do it on a Friday when it's not needed on a Saturday? That's a practical consideration. But a legal consideration is what are you actually collecting from the employees when you host these clinics, and who's getting that information, and how are you storing it? A lot of the vaccine process requires some minimal, personal history about medical information. If you have the health department coming on site with Rite Aid, let's say, then it's going to, and they're collecting that information. Rite Aid is subject to HIPAA rules. They'll protect that information the way they're required to. If you as the employer were collecting that initial pre-screening information, you have to make sure you're not collecting genetic information under GINA, and you have to make sure that you're complying with all the ADA confidentiality requirements. So I think you just need to work out the details. I do think it's best to have that third party come out on site. I did talk to a client yesterday who's like, we have 3 nurses, they're ready to go. The nurses would probably be in a good position to collect that information, as long as you're careful that you're not collecting historical information that falls under GINA, the Genetic Information Non-Disclosure Act, for those who don't know. But you also want to make sure that information is always safeguarded in confidential medical files, and access is limited. Now, the questionnaire itself is maybe not a health record unless it goes into that historical information, but it depends on what you're asking. So you just really need to think about that paperwork that comes along with having the clinic on site. And as far as liability goes, before I turn it over to Brandon, there is some immunity under a statute called the PrEP Act for employers who participate in disseminating, these measures that help to prevent COVID. So likely you would have immunity because you're coordinating with the health department to get this vaccine clinic on site. And then keep in mind, Ohio early on passed a general immunity bill that provides immunity to businesses if their employees contract COVID. It doesn't specifically address vaccines, so it's a little bit iffier as to whether it applies here. But maybe Brandon, how easy is it? You can tell us, how easy is it for an employer to get a hold of the health department or Rite Aid or something to get them on site? Is this something available only to large employers, or could a few small employers agree to band together to bring you guys on site? How about the logistics of that, if you can help us with that?
At this time, we're not doing the smaller, just individual business pods, just because it is labor intensive. It does take planning and effort to set up and organize. If you have a larger corporation, we're like 500, 1,000 employees, that could be a different story. And I can give a contact to Julie in that case, that you could email that contact to inquire about that.
Right.
But another consideration is, if you do hold one of these pods, you also have to make sure that that information gets reported to the state through the proper systems. Mm-hmm. So it's not just collecting the medical record, or making sure that information is private. It's also making sure it gets reported to the state properly, which if you had a Rite Aid or you had the health department, that would get done. But that's just one of those other considerations. If you have on-site nursing staff saying, yes, we'll do it, it's something to keep in mind.
Yeah.
And I have another question. If we're not going to, if we're going to have on-site associates asking those questions, the health history type questions, I would have to assume there's just like kind of like a set, very short list of questions that should even be asked anyways. I mean, is that standard somewhere that you could share or speak to? Mechelle or Brandon, I'm not sure.
Yeah, I don't know if the health department has something like that.
I mean, we have the forms that we have everybody fill out. I don't think there would be an issue with sharing that form.
Right.
I'll check with our people and make sure of that, but I don't see an issue myself with sending that. And I can send it to Julie to distribute.
Yeah, and I think what it's when they're asking, the form I filled out to get mine, I got my first at an employer's on-site clinic. I basically was asked, just, have you had a reaction to a vaccine in the past? Are you sick now? Do you have any COVID symptoms? Things like that. None of that would fall under the Genetic Information Non-Disclosure Act. But when you get into, have your family members had shots? Have anyone in your household had COVID? That becomes historical medical information that is considered genetic information under GINA. And that's where it can get trickier. I think the pharmacy, that form that I filled out was through Rite Aid. I think they're pretty good about not collecting that information because they're well aware of that statute. But I think if you're going to come up with something on your own, you really need to think about that and work with counsel or work with the health department or the pharmacy to make sure that your form is limited to just what do you need to know to have this shot.
Okay.
Period, you know? Mm-hmm.
So the next question is, I think, is more cultural based, but I'm sure it exists today, or will certainly exist in some HR professionals' life in the near future. What happens if you have an associate that comes to you in your HR office and says, hey, you know, my boss is anti-vaccine and he or she is not encouraging it, and you know, what does this mean? And especially if it's happening within an organization where there's the approach is voluntary and the approach is more of the education and the encouragement of associates. So, you know, assuming that this is like a non-mandatory type situation. Right.
You know, these are tough questions because look, there's not a legal duty to promote a vaccine. The health department wishes there were, you know, I think it would help them a lot if there were, but the truth is there is no legal duty to be promoting this. You can be silent or you could be negative, but understand that people are going to disagree. And the more you're talking about it negatively, you're creating dissension in the workplace that's going to distract your employees anyway. So I would advise any person in leadership not to have these discussions because you're just taking away from getting the work done. But ultimately, you know, you don't have to promote it. And you in most cases, you know, if your employer doesn't ask if you took it, there's no reason for you to tell them. I think it's hard if you're someone in HR that wants to encourage people to get the vaccine and the owner of your company is saying, don't do it. I think that presents a problem and you kind of have to, you know, I think the term you used, Alicia, when we were talking about it was align through leadership, right? And maybe you can talk about, you know, how do you do that? How are you doing that as an organization?
Yeah, that's absolutely right. It really is cultural and it's alignment, and every organization is going to have a different approach and thought process around it. And at Libbey, we have executive leaders and non-executive leaders participating in a number of the V Project committees. And so that's allowing us to receive and provide insights and really stay connected to the community and the progress. But it does something bigger than that. It makes a stance, and it shows our commitment as an organization to this progress and to the V Project and the importance around vaccinations. And so our commitment to the committees, our progress, and being transparent in how we're communicating with our associates on that progress, I think really helps to try to mitigate some of these situations that could occur or may be occurring in other organizations. It really kind of starts at that top senior leader alignment, and then the buy-in all throughout and kind of cascading that within your culture.
Yeah, I think that's great. And I think that's how you do it. And, you know, as an individual HR person in that situation, I think you have to align yourself as best as you can and, you know, do what you think is right, but also not jeopardize your own employment. So I think it's a tough situation to be in.
It really is. And I think from a communication standpoint too, I think there's a fine balance, because I think it's important for associates to see that alignment at the executive level and at the senior leadership level. But I also think it's important for the educational pieces to not just come directly from the top down. So another thing that we're doing at Libbey is we're leveraging our health and welfare team and messaging as kind of the primary channel to communicate and engage our associates. So it's really nothing out of the norm. Our health and welfare team is always educating and sending messages to our associates about various health and welfare topics. And so for them to be also educating our population on COVID, I think it just creates more of a trustworthy type of approach versus having kind of an aggressive, it could be perceived as a more aggressive communication approach coming from maybe our CEO, for example.
Yeah, and again, then it looks more coercive coming from the CEO and not voluntary. So I think you're on the right track there. So what about the people who take the vaccine? Now what?
Right, exactly. So do we have to give them paid time off to take the vaccine? Can it just follow kind of standard work
Right.
schedules? What does that look like?
Yeah, I think initially, maybe it was hard to get the vaccine and it was limited to certain times. I think as things open up more, people can get it on their own time. There are weekend clinics. I think as the availability expands, there's no reason that people need PTO to get the vaccine. Unless you're making it mandatory and saying you have to go to this clinic at one of the local hospitals at this time slot, then I would probably pay the PTO for that. If you're saying it's from 2 to 6 on Thursday, go, and you're encouraging that strongly, I would probably offer PTO for that, even though it's voluntary. But otherwise, if you're just saying, go get the vaccine, we encourage you to get the vaccine, do it on your own time, then I don't think you need to use the PTO for that.
Yeah, I agree. And that's similar to what Libbey's going to be doing. We're in discussions right now with Rite Aid and hopeful that we can have an on-site vaccination clinic, and we will schedule it during work hours and after work hours. And we will just follow kind of our normal schedule and PTO policies, but would not be offering, paid time off, since it will be more of a voluntary approach.
That makes sense. And if it's mandatory, pay the PTO. Save yourself the headache, I think that's pretty clear. But I think that opens the door to the next question, right?
Right. Yeah. So then if someone does go on their own time and then they have a bad reaction and they need to take time off work, should this be a sick day or a paid day?
Yes. And one of the things I first like to point out is under the stimulus bill that was just passed, the American Rescue Plan of 2021, they included a provision that you could use the Families First Act, Coronavirus Response Act leave, FFCRA leave, for getting an immunization or addressing side effects or allergic reactions. So they specified in there that you can use that paid leave. Now, it's no longer mandatory to give the FFCRA leave, but it is voluntary. And if the employers are voluntarily providing it, they need to let employees use it for this reason. I also think even if that leave is not available, that they should be allowed to use their normal PTO, vacation, or sick, just as they would for any illness, because basically that's what a vaccine reaction is. And, if they have an allergic reaction, that would be covered. If the allergic reaction is severe and they end up hospitalized, I think that would be covered under FMLA. That's still a serious health condition. Those are pretty clear. Less clear is, would workers' comp cover this? I think, again, if you're in a voluntary format, then it's very unlikely a workers' comp claim would be covered, because they had the choice to not do it. As long as you weren't coercive, you're probably okay. It becomes a closer question if you're doing it on site, but I would still say if it's voluntary and you're just making it available on site and they could have chosen not to go, then I don't think that's really in the course of scope of their employment under the workers' comp laws. So interesting issues all around.
Yes,
I think Brandon had something to add to that part of the discussion as well.
I was back and forth. You guys can continue. We're good.
Okay.
You sure?
Free to jump in.
Yes.
Yeah. So ultimately, I guess that brings us back to, where does that leave you, Alicia, with Libbey? What are you guys planning to do? What's foremost on your mind right now as you start planning? I know you guys are still closed in your offices at headquarters, right?
Right. That's right. We have a handful of individuals in the office. Our stance right now is, if you can work from home, you should continue to work from home. But at the same time, we're also encouraging associates to come in if they want to come in and if they are able to come in. We are hopeful that in the next couple of months that we will be able to see more and more associates in the office. And so we're doing a lot of work right now in preparation for that. And, we have kind of the standard protocols, I will say, in place today. So it will continue with that, with the social distancing, the mask wearing, sanitizing, the kitchen areas are closed. We really want employees to feel comfortable coming back. But then there's also going to be this balancing act of assessing roles and what roles need to be in the office full time today versus what roles can continue to be remote. And so I think there's a lot of work to do there. But one of the things that's on our minds and questions that we've thought about as we're thinking through vaccinations and reopening our offices is, right now today in one of our protocols, if someone says, I'm ready to come back in the office, we kind of have a short series of questions that we ask. And it kind of similar back to the conversation we were having with, the vaccination clinics, if what questions get asked. And so we ask kind of the standard questions that you would get asked if you call the doctor. Have you been exposed in the last X number of days? Things like that. And I'm wondering, as we're continuing to review and revise those protocols, is that appropriate, Mechelle? Is there something else that we should be doing as we're reviewing and preparing to finalize and get more people back in the office safely?
Yeah, I think those questions are still appropriate. I think you still want to make sure people aren't coming to work when they're sick, as Brandon pointed out in his presentation. You still want to make sure they haven't been exposed, and actually that kind of changes my answer here a little bit, because what Brandon said earlier is if you've been vaccinated and you've been exposed to someone, then it makes sense that you can come to work. You don't have to quarantine. That kind of, initially I was saying you don't need to ask if people have been vaccinated, because what's going to change? You're still going to socially distance. You're still going to quarantine if you're exposed, but now you don't need to quarantine what if you've been vaccinated. So that might be a reason for employers to ask if people have been vaccinated. But I'm still not thrilled about creating a list of who's been vaccinated and who hasn't, because as you make employment decisions and you have to discipline people and they're not on the vaccinated list, are they going to say you're retaliating against them because they didn't get vaccinated? It can still open the door if you're maintaining this list. But if you're using it to know who needs to quarantine and who doesn't, I'm not sure you need to know that every time they come to work or every time they come back from a leave. But I think for exposure purposes, if someone is positive in the workplace and you're doing your contact tracing, then you might have a basis to know if certain people in the area have been vaccinated. And then, as Brandon said, they don't need to quarantine. So I don't know that I would add that question right away. Yeah, go ahead, Brandon.
And if that becomes a concern too, during our normal contact tracing process, our tracers will ascertain that. They'll ask if they've been vaccinated. Oh, you had contact with Joe down the hall. They called Joe. Oh, Joe was vaccinated. You're fine to go, without the original person ever knowing, or without the business necessarily knowing. So our tracing process will uncover that. And if you're uncomfortable collecting that information, or that's a gray area, I mean, the normal process will cover that essentially.
Yeah, so, which is another reason why you should involve the health department if you do have an exposure at work. Mm-hmm. I would say so that their contact tracers can do that work for you. Yeah, good to know.
But then what about the protocols? So if we have set protocols in place today, and then, we get back to an open office, we have employees returning who are vaccinated, some who aren't. Do we need to have different protocols for those who are vaccinated and not? I think Libby's stance is, whether you're vaccinated or not, you're going to continue to follow the safety protocols. And maybe this is more of a question for Brandon, but what's the thought process on that?
So right now, the protocols are largely the same. Even at the health department, when we're on site, a lot of us have been vaccinated, not everyone. We still wear masks when we're walking through the hallways, when we're in meeting spaces. The CDC has come out with guidance that says if you have two or more fully vaccinated individuals, those are the only people in a room. They do not have to wear masks while they're together, or not around people who are unvaccinated. The risk of a vaccinated person spreading the virus is significantly lower. They're still ascertaining the complete risk a little bit, but it's to the point that we would still recommend wearing that mask while you're going through areas where you don't know the risk of the people around you. Maybe there's an immunocompromised individual who couldn't get vaccinated because they have severe reactions. You wouldn't want to risk giving it to them if you had been exposed. But generally speaking, if you have a meeting and everyone there is fully vaccinated, you could take your masks off for that meeting around the table, or the room, whatever. And otherwise, we still recommend the social distancing, mask wearing. But the protocols only really affect those people who are fully vaccinated, where some of that difference might come into play. But if you don't know who all has been vaccinated in a workplace, your protocols are not going to change appreciably.
Right, and that could be very challenging to enforce.
And people lie.
Exactly.
Honestly, I would
it
not change my guidance based on who's vaccinated or who's not, like as a legal matter, because you don't know. People could just say they're vaccinated just so they don't have to wear the mask anymore, and you could create a public health problem or an issue at your company. My preference is just until the science is there that says vaccination, you don't have to wear a mask, still do it and follow all the health protocols. I think that keeps you in compliance with OSHA, it keeps you in compliance with health department regulations, it prevents workers' comp claims, and generally just keeps your employees safe. And I get how annoying it is to people, and frankly, I have a hard time hearing, so it's hard to understand people with masks on for me. But I think that you should still do it until the science is really there to say. And I think there may be a point, like Brandon suggested, where the science is going to change on this, where it's going to say you're okay, but we don't know that yet. So let's err on the side of caution here and not make two sets of rules and try to track all this health information and who do we share this information with and how are we tracking with, and let's not do that. I think that's creating a bigger problem than we need to at this stage when we can just do the social distancing.
And just to add my asterisks back in, if you were fully vaccinated, exposed, you don't need to quarantine unless you develop symptoms. If you develop COVID symptoms, you need to go into the isolation, and you should get tested and all that. So that is that caveat, because that also helps the CDC, the Ohio Department of Health, understand what happens when vaccinated individuals get COVID for the first time or again. But yeah, that's that little asterisk on that. You don't need to quarantine until.
You sound like a lawyer with your disclaimer.
Yeah, it sounds like it could really become an administrative burden. And I think a lot of organizations would look to HR safety teams to carry some of that administration and that burden in. I think we all know that the capacity these days is very, very slim in most areas, if not all. So yeah. I agree. And I'm happy and thankful that, Libbey has taken the stance of kind of, even if you're vaccinated, we'll continue to follow our protocols as of right now. That's good.
Good.
So I think the last thing I have really is, as an HR professional, there's a lot of things changing daily from, regulations and with COVID, and we have a new administration in place, which is also driving a lot of change. It seems almost by the hour. And so it can be incredibly overwhelming. And we know that we have internal or external counsel partnership, which is great. But what are some tools or resources that HR professionals can be leveraging or should be leveraging, whether it's just some sort of email subscription of something that, Mechelle, you would recommend that could kind of just help us stay abreast and ahead of some of these changes?
It's a great question. I wish I had an equally great answer, but I look at so many different things. I mean, I'm probably reading easily an hour a day just to keep up on changes and what's happening. I have bookmarked, my whole coronavirus section of my my bookmark has, state resources, the health department page, the CDC. I've had the CDC update the page between the time like I edit a document and then I schedule the call to talk about it. The CDC has made changes. So I think that's sort of slowed down the pace of those changes now. But, it's something where I'm just constantly telling clients, look, this stuff is changing literally by the hour in some cases. So we have to double check what we're saying and understand it may change. But I have found some of the best resources are certain email lists that come to me. Bloomberg has a service that has a coronavirus update that they send out daily that's been helpful on employment law issues. I told you about Morning Consult is like a survey company, but they have a pretty handy email that comes usually at the end of the day, and a lot of surveys about attitudes towards vaccination, but really just updates about Health and Human Services is doing this, CDC is doing that. And it's usually 3 or 4 bullet points that I can just read briefly and know that I know sort of where things are, especially when there were supply issues, they were covering that really well. And I found it surprisingly helpful. So Morning Consult, like CONSULT, it's been great. And just their surveys are pretty helpful to see where the attitudes are. I do read the general newspapers, I've got the New York Times, CNN, whatever you like. I do, sometimes that just comes there first. So I see that at the top of my, my alerts on my phone. That's where I get the news from before I even know what's happening legally. Usually we get that. So I wish I could say there was one definitive source, but there's so many different things depending on what you're looking for. It's a really good question. I need to give it more thought, and maybe I'll update Julie. I know for a long time, our firm had a coronavirus resource page that we were keeping updated. As things have settled down, it's, the content isn't coming out as often, but it's there. Brandon, do you have any suggestions on this? I don't know.
Other than keeping up with the major CDC, the Ohio Department of Health's website, our website, we're trying to update guidance too, but every once in a while, it takes us a little bit of time to get the updated guidance you might have heard in the press release into something consumable. So if just checking, especially the state, us, and the CDC is always a good starting point, though the CDC can be overwhelming. I will say that if you're.
It really is. It is. And, for me, I think this is why I end up getting a lot of client calls still, on all of these issues, because it is hard to find information in one easy to use source. So they're sort of keeping me in business. But truly, and a lot of it is just general information, and you do need counsel to assist in just kind of narrowing the issue down to what matters for you. So I do think you should keep calling your counsel. Those short phone calls could save you a host of money going forward.
Good. I don't think I have any more questions. I'm not sure if we've had some more questions come through. Have we had any more come through the queue?
Yes.
Let's see.
Yeah.
Bob, are you going to take us through the Q&A or chat?
I'm trying to, but I think my my microphone might have gone off here.
Okay, you're back.
Okay, can you hear me now?
Yeah.
Yes.
Okay, good. So yes, we do have a couple of questions, and one thing I'd want to clarify on there, from a legal standpoint, we actually can ask if people have been vaccinated, right, Mechelle?
Yes, I mean, that is not, the EEOC has issued guidance on vaccines, and they've made it clear that just asking if someone has gotten the vaccine is not a disability related inquiry where you would need a business reason for asking that. So you can just go around and asking. So it's more of a practical question of why are you asking and what are you going to do with that information, and how are you going to, make sure.
Yeah, from what I've heard, the key thing is if they say no, I haven't, you don't want to ask why aren't you doing that? That's
correct.
That's
correct.
So and that kind of relates to the first question, because we went to the idea of offering incentives for that. So the question is, can I offer an incentive where we enter everybody who has been vaccinated into a raffle, and can I request then that they give me proof that they have been vaccinated? And it seems to me that should be okay to do something like that. Would you agree with that?
I mean, the thing I don't like about that is, then what about the people who have a disability and they aren't able to be vaccinated? Exactly. Are you going to enter them in just because they have an exemption? And if so, then I'm much more comfortable with it.
Yeah.
And then
and I agree. That's exactly what I told somebody else that asked about that the other day. Is like, well, you still have to be prepared. Some people can't get it. And so if they say, I want to be entered in, but I can't get the vaccination, I wouldn't argue that point. I just say, okay, no problem, you're in. So
right. And then what kind of proof are we mandating? Are we requiring? Let's make sure that it's just, did you get the vaccine or not? Not the historical information that might be prohibited by GINA. And then if it's medical information on there that has the pre-screening or something, then we want to make sure we're safeguarding that under the ADA rules.
Yeah. Yep. So that gets to somewhat the next question also related to that. Can we ask new hires if they've been vaccinated or not? And I think it would be the same answer. Yes, you can, but just be careful with what you do with that, and don't go beyond asking, if don't ask why they did not receive it if they did not. So
correct.
Yeah.
And I just want to add, Mechelle, to that too, though, we also should not be asking about their family members, just as a reminder. So we're only asking the associate, and that's it. We don't want to inquire any further beyond that.
Yes, that's right. Yeah. That because of the genetic information law, it becomes very tricky.
Mm-hmm. Right.
Yep. So then another question there, you guys have addressed already, I believe. can we allow employees who have been vaccinated to not have to wear a mask at work? And what you were saying, Brandon, is the only way we'd want to do that is if you have two people or a group of people who have all been fully vaccinated, and then you could do that. However, that gets tough administratively. It's probably safest to just continue to require the mask mandate in most situations.
Correct.
So, okay.
And I have a question on that one, actually. The vaccinated individuals cannot wear a mask, but do they have to be in a room with the door closed?
Reasonably secluded. I mean, if
Okay.
it's just an open air office and they just happen to have two cubicles next to each other, but there's other people around, they should wear a mask. But
Okay.
if you're in a room where maybe there's not an actual door on it, but people aren't wandering in and out, I think that would be reasonable.
Okay, thank you.
Yeah. So again, just another little clarification in terms of confirming somebody's vaccination. Can we actually ask to see their vaccination card? And again, from what I've read, yes, that is true.
Yeah, and I don't think there's anything on the vaccination card that would be private or considered confidential. You know, the birth date's on there, but other than that, you know, I don't think there's any problem with seeing the card itself.
Yep. And I'll just make one comment about the source for information. Don't forget about the Employers Association.
Oh yeah, sorry.
Who are members. Our Kelly Beard has been sending out regular updates on there, and it's impossible to get everything, of course, but we've been trying to really be very conscientious about just summarizing some of the changes that have been going on with the CDC or with the Ohio mandates or the DOL mandates and those kind of things. So we've been really working hard at making sure that that everybody is updated with those essential items on there as well. So.
Thank you.
That really is an excellent resource, Bob. It really is. And the one thing that I would also add to that is something that Libbey is really taking a step back and reassessing is our wellness strategy. And specifically part of that is health, mind, health and wellness. And so the brain health series that the EA offers is something that we're assessing right now. I think we're seeing a lot of struggle in our community, and we can't be naive to the fact that that's not happening within our organizations. And I just think that's kind of COVID related and just another area where we can really lean on the EA for some support there.
Yep, absolutely. Thank you. I agree. That's a great series. So if anybody's interested in that, feel free to contact us and we can give you more information about that. So
Anecdotally,
Julie, I think we're at 3:02. We're over a little bit, but if there's anything else, Brandon, you had something else you wanted to add?
I was just going to anecdotally add to Alicia's point that right now in the community, the health department, other organizations, we're doing the community health improvement plan. Separate from COVID, we do this every 3 years, but we did a quality of life survey for it. And of the 700 plus respondents, 56% said that their mental health had been impacted by the pandemic. So that's definitely something that's great that they're looking into that, and just something to keep in mind to consider.
Yep. And I guess just to kind of refocus on why we're doing these things, it's all about getting the vaccines, right? And the greater number of people we get vaccinated, the more likely it is we're going to be able to get back to normal, interact with other people, and help improve those brain health issues, those mental health issues as well. So again, just everybody encourage your folks to get the vaccine. I'm going to get my second dose on Friday, so I'm happy to report that. And so another couple of weeks I'll be fully vaccinated, as will my wife as well. So
yeah, it's exciting.
yeah,
it sure is. Well said, Bob. We appreciate it. And Alicia and Mechelle and Brandon, thank you so much for your time and this great candid conversation. I left my camera on, so many of you probably saw me furiously taking notes. So I appreciate the great information. Again, everybody, thank you for joining us. And again, look for an email, probably usually within 24 hours, to have this conversation and the additional resources Brandon talked about included in that too. Bob, if you can also send me a link about your brain health program, I'll include that link as
Yep.
well, as there's some interest in that. So thank you, everybody, and have a great afternoon.
Thank
Thanks for having
you.
us.
Thank you.
Thanks.
Bye.